Hello, I'm Subramanya from SumanTV. Indian pharma industry has been trying to help Indians and all the people across the globe to take care of their health and have a great quality of life. Particularly nowadays, people habits change, stress has become part of life, food habits change. So because of these all changes, people are suffering with chronic disorders, particularly lifestyle disorders. When it comes to hypertension, when you meet a doctor will suggest you certain tablets, and he will also suggest you to bring certain lifestyle modifications. So if you are not following these, what is going to be the outcome? To understand that, we have a session engineer sir with us who is having more than 30 years of experience, particularly in cardiac segment, and he has built a lot of pharma brands. So let us understand from him. Hello, sir.
Hi, Subbu.
Sir, thank you very much for coming for our podcast today.
Yeah, always pleasure to be with you.
We feel so happy, sir. We are in the field of knowledge sharing,
Yeah.
and the knowledge will make the people to have a great quality of life.
Yeah.
Sir, when it comes to hypertension,
Yeah,
as you know, when they meet the doctor, they suggest certain tablets to use morning, afternoon, or evening, and this many days, and one pattern. Along with that, they also suggest to bring certain lifestyle changes and food habits also.
yeah.
And in reality, many people are not following it, particularly when it comes to tablets and then blood pressure. If they don't adhere to the treatment regimen, what are the consequences, sir?
It's a wonderful question, and it is so relevant that worldwide, especially in India, 40% of premature deaths are happening because of lack of adherence, as per WHO study.
So, sir, you are saying that World Health Organization has done a study, and 40% of people who are dying because of blood pressure,
Premature deaths or
Premature
like chronic
death.
diseases
Yeah,
is happening
premature
because of the non-adherence.
because they are not following the doctor prescription.
Yes,
Oh,
they are not following. As you said, it's not only about the medicine,
okay.
but the modification. So, three things you have to remember: 3M:
Okay.
medicine,
Okay.
modification,
Okay.
and monitoring.
Acha, medicine, modification, monitoring.
Monitoring.
Fantastic. So 3M.
Now, 3M.
Very
so
good.
there is a issue of compliance at all the three levels. No, so there are patients, those who once declared hypertensive,
Okay.
they go, doctor has prescribed medicine, because all good doctors, or doctor per se, all doctors are good only.
Yeah.
They first try to tell people, if they are early into hypertension, that cut your salt, improve your lifestyle, do exercise, reduce stress.
Yeah.
And they will give some anxiolytic and tell them that you come after 15 days. The patient will because they are not able to see immediately the consequence of not doing that.
Okay.
They do not go for compliance beyond a day,
Okay.
because we are today in the world of instant gratification.
Correct.
So human mind is very logical. It says the cause and effect relationship.
Yeah.
So this is, first of all, worldwide, especially in India, is a cultural issue. So very key important thing here is communication.
Okay.
And in Indian population, where doctor to patient ratio is horrible in terms of one doctor has to see so many patients. So the basic communication to the patient
Okay.
has to be taken care by the healthcare system, which is not happening. The day he was diagnosed and he is not following, he has to visualize that one day he will not be able to see, one day he will be on dialysis machine, his kidneys will not work, and he will die, or he can die premature death. This reality, which is going to be there after 5 years, 10 years, 20 years, have to be seen by patient the day he is diagnosed.
So you meant to say that
Understanding of the disease.
from the beginning, they need to have a great understanding related to treatment adherence, following lifestyle modifications, and following per se doctor instructions. And most of the people are ignoring in reality.
People are fine not going to very specific, reaching to office at 9:30, because that day salary will be there.
Yeah.
But if you are not adhering to the time of 8 o'clock for your medicine,
Okay.
because your one day life will be cut short because of that.
If they don't take a tablet for a day, you are saying that one day of their life is going to be
Maybe
out.
one day,
Can
if
say.
your habit, your BP is not controlled, your BP went up to 200. You
Okay.
got hemorrhagic stroke.
Okay.
You are gone for the life. This is importance of adherence, which is very, very important.
Okay.
Second thing, Subbu, human being, inertia is a rule.
Major
They
issue.
would not like to do what others have tell them.
They are
unless
comfortable
feel
to do what they
motivated,
wanted to
what
do.
they wanted to do. And change in behavior is an exception. And as per Newton's law, force is required. And that is where the family support,
Okay.
the healthcare provider support,
Okay.
the doctor communication, paramedical staff communication,
And
they
people,
all
people like us who are trying to
correct.
enlighten them.
That is what I say. Product managers
Yeah.
in India,
Yeah.
they are much featured in busy in doing things those who do not add value to the patient. Do something which helps the patient to comply better to the doctor's therapy.
Particularly pharma product
Pharma
managers.
product. That is one very, very important area. Second is, many times doctors don't have time. They don't make the patient understand each and every dose, importance of each and every dose, and each and every tablet, and how it works.
Okay.
Suppose you have written beta blocker and calcium channel blocker. You tell them that these two drugs are going to work on your heart as well as your blood pressure, so that your BP will be under control. So the patient has to visualize, okay, one will control my heart rate and another will control my blood vessel, so my BP will be under control. I have to take it at 8 a.m. So that understanding, that education has to go. So that is very, very important.
Okay.
In case of and second, one thing very important, chemist here is in hurry to either substitute or just make the bill. It is job of the pharmacist to explain each and every doses to the patient.
Yeah.
Nobody has got time.
But here the problem is, sir, in India, if you see in reality, how many pharmacies are having the qualified people as the boys in the pharmacy? That is a big issue. They will have a boy who is distributing medicines of 10th fail, inter fail, or degree fail. That is one of the area which government and everybody should work also.
Yeah, government should work.
Yeah.
But people also should be aware, because it is their life. So
yeah, correct, sir.
now when you have 96 crore of people using broadband in India,
Yeah.
people keep on scrolling through reels all through the day.
Correct.
Can't they search what is there in importance of therapy?
They should actually.
Right. And these triggers should be given to these people. Just because you don't care, the chemist is able to substitute the product.
Correct.
And in the world of spurious medicines,
Yeah.
you always go by the doctor, what doctor says, because he knows
Absolutely.
what he's doing.
Yes, sir.
Indian doctors are unique in a way, they take the accountability of the outcome.
Absolutely, sir. That is where doctors are so serious about their decision making.
Fortunately, Indian doctors are great in terms of taking very
Care.
special care of the patient.
Absolutely.
They are concerned about outcomes.
Yeah.
They tell everything to patient. Yeah,
Correct.
of course, the load is very, very high.
Correct.
So there has to be ecosystem which will help. Pharma companies can play very important
Significant role in this.
role. Right. I remember that when I was working in Dr. Reddy's,
Okay.
Dr. Reddy bought a pure generic company, Beta Farm in Germany,
Okay.
only because that company had no different product,
Okay.
but that company had a wonderful way of delivering healthcare to the patient.
Excellent.
That if you are prescribed a product, suppose diclofenac injection,
Yeah.
then you don't have to worry about who will give that injection.
Okay.
Beta Farm guy will go and he will give you injection.
Wow.
So that is, everything is bundled together.
Yeah.
There has to be a way where compliance is ensured.
Sir, as you say in marketing, either you have differentiated brand
Yeah.
or at least you differentiate service.
Service and experience to the patient.
Correct.
The delivery, the experience, which is very important.
Correct. So you said that medicine, monitoring, modification.
That's
So-
three simple things.
Yeah.
People remember this, they will
Yeah.
be all fine.
So lifestyle modifications also they should completely follow without
Yeah,
ignoring
it's
it.
not a rocket science, Subbu. Only you have to do some restriction on yourself.
Yeah.
Like we discussed.
Discipline should be there.
You don't
actually.
take biryani more than 2 times in a week.
Correct.
You don't take cold drinks. These
Yeah.
are simple things, avoidable. You can start enjoying.
Yeah.
Now, modification, what doctors say, before you eat your rice in the afternoon, eat 1 full plate of salad. Your calorie intake will come down. It's not a great science.
Yeah.
Find out 10 minutes to do exercise in the office, stretching.
Correct.
It will improve permeability of your muscles and glucose will get utilized.
Okay.
Your insulin resistance will get better.
Yeah.
So this is how modification is not about that you have become something very, very different and alien.
Yeah.
It's all about daily we can modify. So your body has modified to keep you alive
Yeah.
when your beta cells was not working.
Correct.
So you also got need to modify.
Absolutely, sir. Now what I understand, sir, particularly to manage the blood pressure, cardiac issues, whatever doctor give the prescription, as per his suggestion, they are strictly follow that.
Follow that.
And lifestyle modifications also. As you said, we are hurried to reach to office by 9:30 without fail because we are going to lose the salary.
Yeah.
And they also have the same kind of seriousness when it comes to involve themselves in lifestyle modifications also, because this is more important. If you live, then only your salary also will come.
Yes.
So it's a very good information, sir. Thank you. Hello, friends. Now please understand, when it comes to the management of hypertension, whatever doctor suggested, like, you are supposed to take this tablet in the morning, this tablet in the afternoon, this tablet in the evening. You don't have any luxury to skip it. You have to follow ditto. And another thing, whatever the lifestyle modifications he suggested you, though your body is not a position to support you, still you can make yourself ready to go and follow that instructions. So treatment, adherence, and then modifications, and all these two things, monitoring. These 3M makes your life more qualitative, and you can have your blood pressure under control. So thank you very much.